Hello, future surgeons. Welcome to today's High Yield Explainer. We're diving right into a topic you absolutely cannot escape: the surgeon's arsenal, specifically high-yield blades and energy devices. Whether you're stepping into the OT for your very first rotation, or you're just grinding through those late-night MCQ banks, ye topics bar aate hain. They repeat constantly. We are going to make sure these concepts permanently stick in your brain today. So grab your virtual scalpels, sit up straight, or chalo shuru karte hain. Okay, let's kick things off with a classic, direct MCQ hook. Why can't we use monopolar cautery during penile surgery, or say, near a pacemaker? Examiners literally love this concept. So just kabadame for a second. What is the fundamental biophysics happening here? Well, stick with me, because by the end of this session, the exact mechanism behind this is going to be crystal clear. Pukka promise.
तो आज के टॉपिक्स क्या हैं? We've got 4 main modules. Number 1, surgical blades and incisions. 2, basics of electrosurgery. 3, advanced energy devices. And finally, module 4, specialized surgical tools.
Module 1, surgical blades and incisions. Let's master cold steel. Right, so here are your essential surgical blades. Number 10 is your absolute workhorse. You actually cut with the belly of this blade because that's the sharpest part, and it's primarily used for big skin incisions. Then take a look at number 11. Notice that sharply pointed tip? That's your stab blade. Direct MCQ right here. Which blade is used for an incision and drainage of an abscess or maybe an arteriotomy? It's the number 11, for sure. Then we've got numbers 15, 22, and 23 used for various other incisions. And hey, don't forget number 12. It's got this curved, hook-like shape on the inside edge, which makes it absolutely perfect for suture removal. Quick clinical pearl for the OT. How do you safely pass a blade to the surgeon? Always mounted on a BP handle, resting in a kidney tray, with a pointed end facing towards yourself. Safety first.
Now, how do we actually plan a cut on the patient's body? We rely on Langer's lines. These are the relaxed skin tension lines and are based entirely on how the dermal collagen fibers are oriented. The golden rule you must remember: always place your incision parallel to Langer's lines. Why? For a good cosmetic scar that naturally hides right in the skin creases. But keep in mind, while your incision is parallel, the underlying muscle fiber action is usually perpendicular. And when you're physically cutting, your blade should be perfectly perpendicular to the skin, moving smoothly from far to near. Concept ekdam clear hona chahiye.
Moving on to section 2, basics of electrosurgery. Time to talk about hot instruments. Let's break down the actual biophysics of monopolar cautery step by step so the logic of this circuit gets permanently wired into your head. Pura circuit kaise complete hota hai? Step 1, the current originates at the machine. Step 2, it travels down the cord to the active electrode, which is the Bovie tip you're holding. Step 3, the current actually enters the patient's body to cut or coagulate tissue. But now it needs a way out. So, step 4, it exits safely through the grounding pad, also known as the cautery pad. And finally, step 5, it travels back to the machine. So, hamesha yaad rakhna, that cautery pad has to be placed over a well-vascularized area with a wide flat area of contact. If that pad is too small, the current concentrates and boom, you get severe burns at the pad site. And if there's no pad attached at all, the circuit is broken and the monopolar literally won't even fire. So why is monopolar downright dangerous in certain situations? It comes down to 2 words: lateral spread. The electrical current spreads out from the tip, causing collateral thermal damage to nearby vital structures. It also causes something called pedicle channelization, where the current basically runs down to the base of narrow, stalk-like structures. And guys, this directly answers our hook question from earlier. This is exactly why we never use monopolar cautery near end arteries, like in the penile region or the ear lobule, because that pedicle channelization will literally fry the blood supply and cause necrosis. Plus, because the current is traveling through the patient's entire body, it messes with cardiac conduction. That's why it is strictly contraindicated if the patient has a pacemaker. And for sure, avoid it in delicate CNS, parotid, and thyroid surgeries too. Ab compare karte hain monopolar versus bipolar. We just talked about the massive full-body circuit of monopolar. In bipolar cautery, it's totally different. The circuit is completed locally, just between the 2 metallic prongs of the forceps. The current travels out of one tip, passes through the grasp tissue, and goes straight into the other tip. The huge advantage here? No grounding cautery pad is required at all. And since there's 0 lateral spread, it is incredibly safe to use right up close to vital structures and end arteries. But jot down this high-yield MCQ point. Bipolar is used for coagulation only. It does not cut tissue. Let's quickly look at the specific waveforms of the current, because this is a direct exam pearl. What exactly is happening at the cellular level when you press the yellow cut button on your bovie versus the blue coagulation button? Cutting utilizes a low-voltage, continuous current. And the mechanism? It produces intense heat rapidly inside the cell, causing a literal cell water explosion. It physically vaporizes and tears the tissue apart. Coagulation, on the flip side, uses a high-voltage, alternating, interrupted current. The mechanism here is completely different. It basically causes dehydration and protein denaturation, leading to cell death and a structural sealing effect entirely without that explosive tearing. It's a very high-yield distinction to keep straight, guys.
Section 3. Advanced Energy Devices. These are your modern sealing tools.
First up on the advanced roster is LigaSure. To LigaSure, exactly how is Comcartha? Well, it doesn't just indiscriminately burn tissue. It uses a very precise combination of heat plus physical pressure from the jaws of the instrument itself. It actually melts the body's own native collagen and elastin right in the vessel walls to permanently seal and then divide them. It even has a smart computer feedback mechanism that monitors the tissue and automatically stops the energy delivery when the seal is perfectly complete. And here is a highly repeated exam pearl for you. LigaSure can safely seal vessels up to 7 millimeters in diameter. Note that down, 7 millimeters. We also have the Thunderbeat S mentioned here. What's the deal with that? It's basically an awesome hybrid device. It takes the vessel sealing features of a LigaSure and combines them with the cutting features of a Harmonic Scalpel into one single highly efficient tool. Speaking of the Harmonic Scalpel, let's see how this builds on our current understanding. The big secret of the Harmonic? It doesn't use electric current passing through the tissue at all, not one bit. It works purely on an ultrasonic principle. The metallic blade actually physically oscillates back and forth at massive speeds. We're talking between 2,000 to 50,000 hertz. This intense mechanical friction causes protein denaturation and coagulation. But the absolute most important takeaway here? It achieves all this without active heat production. No electrical heat means you can safely use it incredibly close to vital, delicate structures and cut right through tough scar tissue with crazy precision. The only minor downside is that it can feel a bit time-consuming in the OT compared to just blasting away with raw electrocautery. All right, final stretch. Section 4, Specialized Surgical Tools. Let's talk tissue and tumor ablation. Check this out. This is CUSA, the Cavitron Ultrasonic Surgical Aspirator. Think of it as essentially a highly specialized harmonic scalpel that also acts like a vacuum to suck fluid and debris away simultaneously. Examiners love asking about its specific indication. CUSA is considered the absolute gold standard device for liver resections. Why liver? Because liver cells, hepatocytes, have extremely high water content and collagen. They are incredibly susceptible to the ultrasonic oscillatory fragmentation that CUSA produces. So it literally blasts away the soft liver parenchyma while magically leaving the tough, fibrous bile ducts and blood vessels totally intact so you can ligate them safely. Just remember, it works significantly better in a healthy, soft, non-cirrhotic liver. Now, for treating actual tumors inside the liver, we need to compare two super high-yield modalities, RFA versus microwave ablation. RFA, or radiofrequency ablation, uses high-frequency alternating current. Now, because it is an electrical current, it's structurally similar to electrocautery. That means a grounding pad is absolutely 100% needed. We typically use it for liver tumors up to 3 centimeters in size. On the other hand, we have microwave ablation. This utilizes electromagnetic waves to cause water molecule oscillation and intense frictional heat. The massive advantages over RFA: number 1, absolutely no grounding pad is required. Number 2, it takes way less time. And number 3, it provides a much more homogeneous, predictable, and spherical zone of tumor ablation. It's a real game changer. So there you have it. We've conquered the basics of surgical blades, mapped out the physics of electrical currents, and explored the cutting edge of energy devices. Bathal, I have one final question to leave you with. Based on everything we just learned today about circuit safety, lateral spread, and tissue effects, which advanced energy device will you confidently choose for your next 3-centimeter liver tumor resection? And more importantly, why? Really synthesize what you've learned. Think about the grounding pads, the proximity to vital structures, and the exact heat mechanisms. Because mastering these fundamental why and how questions is exactly what transforms you from just a good medical student into a truly great surgeon. Keep revising, keep connecting the concepts, and I'll see you in the next explainer.